I was taking call one night, and woke up at 2 in the morning for a general surgery call. Pretty vague, but at the time, I lived in a town that had large populations of young military guys and avid meth users, so late-night emergencies were normal. I got to the hospital, where a few more details awaited me. Purorectal abscess. For the uninitiated, this means that somewhere in the immediate vicinity of the asshole, there was a pocket of pus that needed draining. Needless to say, our entire crew was less than thrilled. I went down to the emergency room to transport the patient. And the only thing the ER nurse said as she handed me the chart was, "Have fun with this one." Amongst healthcare professionals, vague statements like that are a bad sign. My patient was a 314 pounds Native American woman who barely fit on the stretcher I was transporting her on. She was rolling frantically side to side and moaning in pain, pulling at her clothes and muttering Hail Marys. I could barely get her name out of her after a few minutes of questioning, so after I confirmed her identity and what we were working on, I figured it was best just to get her to the anesthesiologist so we could knock her out and get this circus started. She continued her theatrics the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot, though, chronic drug abusers who don't handle pain well and who have used so many drugs that even increased levels of pain medication don't touch simply because of high tolerance levels. It should be noted, tonight's surgical team was not exactly wet behind the ears. I'd been working in healthcare for several years already, mostly psych and medical settings. I've watched an 88-year-old man tear a 1-diameter catheter balloon out of his penis while screaming, "You'll never make me talk." I've been attacked by an HIV-positive neo-Nazi. I've seen some shit. The other nurse had been in the OR as a trauma specialist for over 10 years. The anesthesiologist had done residency at a level 1 trauma center, or as we call them, knife and gun clubs. The surgeon was ex-army and averaged about 8 words and 2 facial expressions a week. None of us expected what was about to happen next.